So I'm going to be doing the newborn assessment, and first I'm going to check and make sure we have the right baby by checking her armband. And we have Jordan Dormer. And then next I'm going to start with vitals and check her temperature. And I would stick the thermometer under her arm and support her arm. And a normal temperature would be 97.5 to 99. And then I'm going to check her pulse at the apex for a full minute. And normal there should be 100 to 160. Next, I'm going to lay my hand on her chest and assess respirations. And respirations should be 30 to 60. And we're going to do this for a full minute as well. Okay. And then I'm going to listen to her heart tones at the apex. And all should be regular rate and rhythm. And then I'm going to assess her breath sounds on both sides, above the nipple and below the nipple. And they should be clear and equal. And then I'm going to unwrap and expose the abdomen and check for bowel sounds in all 4 quadrants. And they should be all active. Okay, good. Then I'm going to wrap the baby back up so we can move to the head and start assessment there. We're going to take the hat off, and we're going to be checking for molding and cone shape, which is normal. And we're going to check the fontanelles, front and back, and they should be soft. We're going to check the suture lines, make sure there's no gaps between these. And we're going to just palpate the head and feel for and make sure there's no caput succedaneum, which is a soft squishy spot, no cephalohematoma, a swollen area, and no bruising or scratches. And there's none of those. Okay. And we're going to make sure the baby's eyes are symmetrical next. And they are. And there's no discharge. And then we're going to check the ears and make sure they are in line. You're going to draw a line from down from the eye to the outer ear, and if it sits low, that could be a sign of Down syndrome. Next, we're going to fold the baby's ear, the top of the ear down, and it should, once you do that, it should recoil up nicely. And if there's slow recoil, that could be a sign of immaturity. Next, we're going to check the baby's nose for patency, and you're going to cover one nair and then feel for breathing, and then do the same for the other. Good. And next I'm going to put gloves on, and we're going to check the baby's mouth. I'm going to place my finger on the side of the baby's mouth to see that they can find the mother's nipple. And then I'm going to check for sucking, and that's good. And then I'm going to feel the palate of the top of the mouth and make sure that there's no holes, and that's all good. And then next I'm going to check the baby's neck with 2 fingers on each side. Checking for masses, and there's no masses. And then I'm going to tilt the baby's head side to side gently for checking for range of motion. Next I'm going to check the baby's clavicles for swollen areas, and there are none. And then I'm going to check the skin, so we're going to unwrap baby again.